Is it running? Okay. So I'm going to demonstrate a blood draw on a patient. I have somebody to help hold and restrain. I'm going to do a peripheral right cephalic blood draw. I have a 3 ml syringe because I need about 1.5 mLs of blood. The first thing we're going to do is I'm going to lift the leg and we're going to clip a small area. It's always good to clip the area so that when you poke with the needle, easy buddy.
Okay.
I know the clippers are scary. It's okay.
It's okay.
It's okay.
It's okay.
That way when you poke with the needle, no bacteria enters while you're injecting, poking with the needle. You want to feel for your vein ahead of time. And then clean the area with alcohol. It's cold and wet. It's cold and wet. You're a good boy. Good boy. Again, this just takes all the bacteria off. Okay. I have my 3 cc syringe. You want to poke at a slight angle with the bevel up. And don't touch the area after you've cleaned it with alcohol. You want to stabilize the vein and then insert gently at an angle and draw back for your sample. Draw back slow and steady as to not collapse the vein. And then apply gentle pressure at that area to achieve hemostasis at that area. You recap, and then I only have an EDTA tube, so I remove the needle. You don't want to push the blood through the needle as you may damage the cells. You recap, and then gently invert at least 10 times. Then I'm going to fill my PCV tubes. You have, ours are microhematocrit and have a red ring around them, which means they are heparinized. You want to fill the tube about 3/4 of the way and then put it in the clay. Again, you want to balance your centrifuge, so you should do at least 2. 3/4 of the way. And now we're going to run our samples. You can stop. I'm going to demonstrate how to make a blood smear. So you need 2 cotton swabs, 2 slides, and your CBC tube. I'm going to use the wedge technique. So you want to take your 2 cotton tip applicators and put them in, get some blood on the tip of them. And then you want to place a drop of blood using those on your slide. Near the frosted end. And then you take your other slide at about a 30-degree angle, put it in front of the dot of blood, drop back into the blood, let the blood slide across, and then with even pressure, slide across the slide to make your slide so that it comes out into a feathered edge, like that. If you believed your sample to be anemic, you would want to use a greater angle. If you believed your sample to be hemoconcentrated, you'd want to use a lesser angle. Okay. Okay, now once our blood smear is dried, we're gonna go ahead and stain it. You wanna make sure you use your blood and cytology stain, not your fecal and ear stain. We use the 3-step type Diff-Quick. Your first stain is methanol, and it is a fixative. You want to drop the slide in there. The slide should sit in each dip for at least 30 seconds. There's no need to go up and down. It just needs to sit there. So we're going to time that. We're almost ready for the next one. You want to make sure that your stains sit where they can't fall over, so they will stain counters and floors. In between each stain, you want to rinse the back of the slide with distilled water. And then gently tap your slide, as you don't want to move any distilled water into the next stain. The next stain is eosin. It's an acidic, and it stains the basic components of the cells. Again, you want to let that sit there for about 30 seconds. It's always good to recap the stain you're not using anymore. Again, if these spill, it makes a big mess. Your last stain is methylene blue. It is an alkaline, and it stains the acidic portions of your cell components. So we're going to rinse the back of the slide with distilled water. Again, gently just tap the extra distilled water off. You don't want to move distilled water to the next stain. That's going to sit there for 30 seconds. When we're done with that, we're going to rinse the slide completely with distilled water and then let it air dry before reviewing it under the microscope. Okay. Okay, I'm going to spin down my microhematocrit tubes to get a PCV, which is a packed cell volume on this patient. The packed cell volume reads the amount of whole blood in the red blood cells, and it's read as a percentage. So you need to make sure your tubes are lined up directly across from each other so that it's balanced when it's in the centrifuge. Make sure your cap is tight. Place it in the centrifuge, close the cap. You want to set it to microhematocrit tube and press start. Okay. Okay, so now that our hematocrit tubes are done spinning, you remove the stat spin from the centrifuge and you place the reader on top of the tubes, and you want to line up the bottom of the blood with the bottom with the 0, and you want to line up the top of the plasma with the 100, and then you read it at the buffy coat layer in the middle, which is your white blood cells. And this dog's PCV is approximately 55%. If your PCV is elevated, it's a good sign of dehydration. If your PCV is low, it's a good sign of anemia. Next, you want to remove the hematocrit tubes, and you break them right above that buffy coat layer. And you gently tap the plasma out of the tubes and put it onto the refractometer. We're going to read our total solids or our plasma protein concentration for this pet. Same thing, you break the tube gently just above the buffy coat and gently tap the plasma out onto the refractometer. Once you have enough on there, you can close the refractometer, hold it up to the light, adjust it, and this dog's total solids is approximately 8. Yeah. You ready? Mm-hmm. I'm going to now demonstrate how to read the steps in reading a blood smear. So I've got my slide on the microscope. Turn it on. I'm starting at low power, which is 100 times. And you want to focus in and look for platelet clumps. And then once you've decided that there aren't any platelet clumps or that there are, you want to move toward the feathered edge and find your feathered edge and your monolayer. Once you locate your feathered edge and monolayer, you want to focus the microscope on a field right out on the monolayer, right outside the feathered edge. Once you have that in focus, you then need to move to your high power oil. You don't want to put you want to move away from the 40, so you put a drop of oil and then rotate to your high power. And now you want to make sure you count at least 100 white blood cells per field. You're also looking for red blood cells and platelets and the different variations of those cells, such as lymphocytes, neutrophils, erythrocytes.